Elbow is a special hinge joint, is an important
Parag,
link
your
joint.
background noise is there. Can you mute your microphone, Parag?
Do you want me to put everyone mute? So the elbow is a
I'm
special
only on a
hinge.
single device, Vivek.
No, you mute your microphone for the time being.
Okay, sure.
Yeah, thank you.
So okay. The elbow is a special hinge joint. This is an important link joint connecting the shoulder and the hand, which has got two planes of movement, flexion extension arc and the pronation supination arc. And any loss of up to 50% of elbow function can lead to 80% of global upper extremity function. The elbow joint should not have any pain, should be stable and should be mobile with at least 100 degrees of functional arc or flexion extension as well as pronosupination. The elbow is not equivalent to knee. As you see, there are remarkable differences. It is a special hinge, it's a sloppy hinge joint, and you have very less bone stock compared to knee. The ulna is very slender bone, and as I said, two planes of rotatory movement. So treat this, if you treat this as a rigid metallic hinge, and you replace like a metallic hinge of a physical door, this will lead to disastrous outcome. There will be high torque at the interface, leading to loosening of the implant and failure, or the prosthesis may break, or the bone may break. And because of metal to metal, sometimes you will get significant metallosis that can be a problem. Let's see some example. This is a 56-year-old lady, had a total elbow replacement elsewhere with some sort of hinged prosthesis. As you see, the torque force are tremendous, and you see that loosening of the implant with the fracture of the periprosthetic region at the junction of the implant and the bone interface. And this is very early after the total elbow replacement she had, and this is disastrous outcome requiring complex revision. A 58-year-old lady had some sort of innovative implant design, and she had the surgery. And if you look at that, there is an extra articular plate and screw fixation to the humerus and the ulna with a metallic hinge. We know very well that this is going to break because the hinge cannot replace the elbow. The torque force was tremendous, and this is not an intramedullary prosthesis. As expected, within 6 months or so, the prosthesis is broken. And now this is the complex scenario, a very complex revision it needs, as you see here. Another lady, 26-year-old lady, had a total elbow replacement elsewhere with this type of design. As you see, there is some difficulty by the surgeon, as is evidenced by some sort of cement mass in the elbow, as well as fixation, which is not adequate to this, but a wiring around the distal humerus. Inevitably, this patient presented to me with a stiff elbow with the cement protruded mass causing infection, and there is absolutely zero movement in her elbow. She needs multiple stage revision, which is going to be a big task for 26-year-old right-handed lady. So, these cases were not done anywhere in remote part of India. These cases were done right in the city I live in Chennai by general orthopedic surgeons. So, to be successful for a total elbow replacement, we should have the right indication. We should not perform total elbow arthroplasty for anybody younger age group, because we know there's a long term, there is a loosening, we need to do revision, and if it's not done correctly, it gives to a lot of disastrous outcome. Second, you need a good prosthesis. The prosthesis should have a longevity, should be tested both in the biomechanically as well as the clinical term results. You should only use those prostheses. The company should be accountable for its performance. Third, specialist surgeon, for a successful elbow or shoulder replacement, the surgery should be executed by a surgeon who has got expertise in that area or regional specialization. Fourth, of course, we have a compliant patient undergoing physiotherapy, because this patient should be told not to use the elbow for physical labor or weight-bearing activities. So for these reasons, we have arranged this webinar, which is contributed by selected members from both British Elbow Shoulder Society and our Shoulder Elbow Society of India. We have a big panel of experts here. We have Mark Falwood from Stanmore, UK, Royal National Orthopaedic Hospital, NHS Trust Stanmore, is a treasurer and EC member of the British Elbow Shoulder Society. We have Professor Adam Watts from Wrightington. He was with us last week with his arthroscopic talk. He's a research and governance lead for the upper limb unit there, as well as visiting professor at Manchester University. Dr. Anand Arya from King's London is a consultant shoulder elbow surgeon at King's College Hospital NHS Foundation Trust London. We have Joydeep Fadnis from Brighton, is a consultant shoulder elbow specialist from Brighton Sussex University Hospital NHS Trust. And Dr. Bhuvaneshwar Machani is a consultant shoulder elbow surgeon from Sandwell, West Birmingham Hospital NHS Trust, but currently he is at Burgill Hospital for Advanced Surgery in Dubai. The lastly mentioned two names, both Joydeep and Bhuvaneshwar Machani, were my fellows, trainees at Epsom. This is about 10 years ago, pictures taken. And I reconnected with them during the first Chennai Elbow Conclave, which was a joint program to combine with the Best Copeland Fellows Visitation, which was done in March 2019. We had a fantastic 2-day seminar exclusive on elbow conditions, including live surgery on arthroscopy and arthroplasty. We had good fun recollecting the lovely memories of Epsom with my two fellows. So here we have from India, myself and Dr. Ashish Papulkar from Pune. He'll be joining us shortly. And Dr. Parag Shah from Ahmedabad and Dr. Deepthanandan Adla from Hyderabad. So the program is set like this. I will invite Dr. Bhuvaneshwar Machani to talk about the evolution principles indication. It's very important to listen to that because the elbow replacement start with the weird prosthesis to begin with, but we have first generation, second generation, third generation, modification, and understanding the biomechanics of elbow. So many modifications have been done in the prosthetic choice. Indications, very important, he will cover that. Surgical approaches for particularly elbow arthroplasty will be covered by Deepthanandan Reddy. Professor Adam Watts will be covering the unlinked TAR, the way to go. Ashish Papulkar will give some tips for success in performing elbow arthroplasty for arthritis. Dr. Parag Shah will talk about radial head replacement in India. We added this because that is part of elbow arthroplasty series. Joydeep Fadnis will talk about the new procedure for us that he has been routinely using in UK, hemiarthroplasty for fracture. Hemiarthroplasty is going away for the shoulder, but it is probably coming back in the elbow. I will talk about total elbow replacement for fracture, indication and tips. Dr. Anand Arya will talk about the complications of TER, and Mark Falwood will talk about the revision elbow replacement. How do you plan and approach? I'll invite Bhuvaneshwar Machani to give his first talk, please. Thank you, Bhuvan.